You often have patients that have been mandated bed rest by the doctor, or patients who can only get out of bed with assistance, or patients who have been designated fall prone by either staff or the doctor. What is the best way to care for these special patients with their special needs? The Lotecon Bed with the personal care system. The Lotecon Bed is a specialized hospital bed capable of all advanced bed features, such as high-low, Trendelenburg, and reverse Trendelenburg. However, the Lotecon Bed has additional special positioning features that make it ideal in any number of hospital situations. The bed can convert to a chair position, with the torso rising to about 80 degrees from horizontal. The Lotecon Bed provides a pneumatically controlled pressure relief sleep system. The individually controlled split leg feature makes the Lotecon Bed ideal for orthopedic situations, like when a patient's leg is in a cast or immobilized. And in the chair position, the personal care system eliminates the need for a bedpan or assisted use of a bedside commode. With the Lotecon personal care system, patients have the freedom to manage their toileting functions without assistance once they are trained on how to use the bed's PCS system. Patients maintain their privacy and dignity. The system is controlled via the patient control unit. When the system is activated, a brief voice message is heard, the seat opens, and the canister rises into position. The waste canister interfaces with the patient. Movement stops when encountering very slight pressure. The disposable waste canister is preloaded with a gelling deodorizer disinfectant that is activated by the presence of moisture. This permits repeated use of the same canister until it is full, yet the patient does not have to worry about odor. After use, the personal care system gives the patient the opportunity to wash themselves with units of 225 cc's of warm water, which can be hand-directed as needed. Following the wash, a drying cycle with warm air jets follows for intervals of 2 minutes. Patients will feel clean and fresh without any embarrassment. When the canister is no longer needed, the patient control system is pressed, closing the system. The canister is withdrawn and the seat is safely and comfortably closed. The hospital staff will appreciate the safety and ease of maintaining the canister. When the internal water tank is low, or when the canister is full, an alert light indicates the need for staff attention. To change the canister, the nurse simply places the patient on their side and activates the control to open the seat. The nurse pulls the water control knob out of its receptacle and places it in the container. This action pulls the spray nozzle inside the saddle out of the way. The canister top is then placed into position and pushed down onto the saddle. Once the lid snaps into place, the canister is permanently sealed. A new canister is quickly and easily dropped into place and pressed down gently to interface with the water and air supply. The opening is then closed, and the patient can once again resume the desired position. Infection control is crucial in every patient-caregiver situation, and by following our recommended disposal procedures, staff is protected from infectious spills and splashes. The sealed canister may be incinerated or disposed of by normal hospital procedures, preventing possible infectious waste from being flushed into the community sewer system. It is clear that most patients benefit from getting out of bed as quickly as possible. However, there are some patients for whom bed rest is mandated by a physician or for whom a standard hospital bed is not adequate. For these patients, the Lotecon Bed offers increased comfort, flexibility, and safety, as well as preserving patient privacy and personal dignity. Patient comfort is increased because they will be able to adjust the bed to a number of positions, more positioning capability than any other specialty bed. The patient control unit is easily positioned to assist the patient with limited eyesight or limited hand mobility. The nursing staff can lock out specific functions that are not suitable for a particular patient's condition. Patient digestion and bodily functions are improved by sitting in a natural upright position in these situations. The flexibility of the Lotecon bed is a plus for both patient and nursing staff. Because the bed can be adjusted into a sitting position, patients who are fall prone or who need assistance to the lavatory can be helped in and out of bed more safely and easily for both patient and caregiver. Physical therapists have found the Lotecon bed ideal for exercising legs and joints in the approved below-the-hip fashion. And radiology units have also found that the flexibility in positioning the bed allows patients to be positioned perfectly for certain hard-to-take x-rays. The Lotecon bed is truly a multi-focused bed that is not limited for use in any one particular department. During one application, the Lotecon bed may be used for a high-risk pregnancy, and the next for a ventilator patient who enjoys greater comfort, positive pulmonary toileting in the seated bed position, and better drainage overall. Both nursing staff and hospital administration will appreciate the safety aspects of the Lotecon bed. In today's hospitals, back injury from lifting or positioning patients is the #1 claim on workman's compensation for the hospital. And on the other hand, patient falls walking to the lavatory are the #1 cause of liability suits to hospitals. How much better to use a Lotecon bed that allows patients safe and easy access in and out of bed, as well as reducing the physical strain of lifting patients on the part of the nursing staff. In addition, a feature of the Lotecon bed many nurses appreciate is the instant CPR function. By pressing a pedal at the base of the bed drops to a flat position instantly, allowing immediate CPR attention. No other specialty bed offers the features and benefits of the Lotecon bed. Increased patient comfort. Decreased time spent by staff on bedpan and lavatory assistance, allowing for more positive nurse-patient interaction. Increased safety for both staff and patients. Preserved dignity and privacy. Improved positions for better recuperation. Positive infection control of bodily wastes, and versatility from department to department. The Lotecon bed is versatile and will allow each department the opportunity to best serve patient needs. The Lotecon bed is the perfect specialized bed for immobilized or infectious patients, stroke victims, coronary care, IV therapy, high-risk pregnancies, orthopedic procedures such as hip or knee injuries, body casts, AIDS, hepatitis, and diarrhea are just some of the conditions which warrant its use. Comfort, safety for patient and caregiver, flexibility, preserved personal dignity. The Lotecon bed was designed for the better health of your patients and to assist nurses in providing vital, compassionate care.